Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have extradural hematoma. Okay, in extradural hematoma, there is mainly accumulation of blood is seen between the skull or periosteum, between the skull or periosteum and the dura mater. Okay, this is called as extradural hematoma. The most common cause of extradural hematoma. So if this is the skull or periosteum, then this is the dura mater. So accumulation of blood somewhere here is responsible for subdural hematoma. The most common cause of subdural hematoma is trauma to the temporal bone. And what are the blood vessel involved in extradural hematoma? It is actually rupture of middle meningeal artery is most commonly involved. Okay, rupture of middle meningeal artery is most commonly involved. Why is there this rupture of middle meningeal artery or vein can be involved? So what are the clinical presentation of subdural hematoma? In subdural hematoma, the patient presents with the sudden onset of altered sensorium will be seen in the patient, and after some time there is altered sensorium sudden onset. After that some time the patient regains consciousness for a shorter period, and this period of consciousness is called as lucid interval. That means here in in extradural hematoma, first there is a trauma, following which the patient loses consciousness, and again he gains consciousness, and then again he loses consciousness. The period of consciousness between two period of unconsciousness, this is called as lucid interval. Then the diagnosis of, if you see the diagnosis of extradural hematoma is, you can do a CT scan can be done for the diagnosis, and treatment of extradural hematoma is by an urgent per hole surgery can be done for the treating the extradural hematoma. Now, always remember, if a case is given showing that a patient is in coma with a dilated pupil after the lucid interval, if the patient presents with coma with dilated pupil after lucid interval following head injury, okay, always and always think that it is an epidural hematoma. Right, in epidural hematoma, we should do an urgent burr hole surgery. Remember, first and foremost, it is done emergency. You will have to do emergency evacuation of the clot is important without doing any other studies. This emergency evacuation of clot is important mainly to restore the cerebral function of the patient.
thank you and thank you for watching.